After your procedure, I do want you up moving around. And once you get home from the surgical facility, here are the things that I want you to do first. Although I don't want you eating a huge meal, soup and crackers or a small sandwich could be something that will hit the spot. You haven't had anything to eat all day, and so this will be the first nourishment your body really receives. After that, I suggest that you take a small nap, and then I want you up and about walking around your home. On the first day of surgery, I want you to take a few 10-minute walks, one in the afternoon and one later in the evening prior to going to bed. Dinner should be consumed at the dinner table. That's important because I want you to start feeling that, yes, I had surgery, but I can still do some normal things. Whether it's liposuction or a tummy tuck or a combination of both, it is important that you do not apply any heat or ice to the surgical sites whatsoever. Many of my patients will say, well, my back is sore and I want to place a heating pad in that area. And the answer is no heating pads whatsoever. You run the risk of damaging the skin or burning the skin. Likewise, if you use ice on the skin, your skin sensation has been altered and it cannot give you the signals that you need to know if damage is being done. Driving after surgery is very common, but not the day of surgery. You've been exposed to anesthesia, and it's best that you have a driver to safely take you to and from the surgical facility. You may have white compressive hose on your legs that go from the tips of your toes to the upper thighs. These are called TED hose and are used to compress the deep veins of the lower legs. This helps to prevent any additional swelling or potential blood clot formation. The most important thing to understand is that these are to be worn for the first 3 to 5 days following surgery. You may remove them if you've been instructed to shower during that time frame, but then I'd like you to replace them. Until you are up ambulating or walking 10 to 15 times a day and feel like you're really moving around easily, you may discard these hose. My liposuction patients will have compressive garments placed on the surgical sites to prevent excessive swelling or bruising. This is actually really helpful because it speeds up your recovery process. Underneath that compression garment is going to be a foam body cast that I'm going to create for you during surgery. This foam is external on the outside of your skin, but it's really important to understand that this will speed up your outcome as far as healing and recovery time remarkably faster than not using it. Now, this isn't used on all areas of liposuction, but it is most commonly used with the torso areas and sometimes the outer chest wall. During your first post-operative visit, we'll carefully remove the foam from the area so that you can see the result and it can be revealed to you. After that time frame, you'll have additional swelling set in, which is very, very normal and will not distort your ultimate result. I want you walking every day, 10 times a day, minimum, and I want you walking for at least 5 to 15 minutes at a time. Further, I want you to work on some lung exercises, and this will be done with what's called an incentive spirometer. This is something that we will give you at the surgical facility and allows you to take some nice deep breaths, opening up the lungs and exercising the lungs. The #1 cause of fever in the first day to 2 days after surgery is typically because the lungs aren't getting exercised. So if you do spike a fever and it is above the 100.4 mark that we've instructed you to pay attention about, I want you to give us a call and let us know. But most commonly, this is because you're not exercising your lungs. And so I'll encourage you to use your incentive spirometer 10 times every hour while you're awake. One of the most frequently asked questions that I get is, when can I take a bath after my surgical procedure? And the answer to that is once you're fully healed. It is important because the hot water can cause additional swelling to the areas. Give us a call at 512-288-8200 if you're experiencing any of the following: infection, nausea, constipation, hives or itching, excessive pain, bleeding, or swelling, or any other incisional questions or healing problems. All of our patients are patients for life, and that means that we'll be following you for many years to come. And photography is a very important part of this follow-up process. We're very excited that you're having the procedure that we've outlined for you. And while it might seem overwhelming or daunting that we've given you so many instructions today, these instructions are meant to make sure that you have a safe experience. I want you to understand that our core values start with safety, followed by excellence, lifetime partnerships, and being responsive to your needs.